Tadalafil is a medication used to help men with erectile dysfunction by increasing blood flow to the penis, making it easier to achieve and maintain an erection when sexually stimulated. It is also used to treat symptoms of an enlarged prostate, such as difficulty starting urination, weak urine flow, and the need to urinate frequently. Tadalafil works by relaxing the muscles in the prostate and bladder. Remember, Tadalafil does not protect against sexually transmitted diseases, so it's important to practice safe sex by using latex condoms. Be sure to consult with your doctor or pharmacist for more information. When taking Tadalafil, the recommended dosage and timing should be determined by your doctor based on your specific condition. Before you start taking Tadalafil, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth, with or without food, as directed by your doctor. Do not take Tadalafil more often than once daily. The manufacturer recommends swallowing the medication whole, but your doctor may have different directions on how to take it. The dosage of Tadalafil is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. For the symptoms of BPH, take Tadalafil as directed by your doctor, usually once a day. If you are also taking finasteride with this medication to treat symptoms of BPH, talk with your doctor about how long you should continue taking this medication. To treat erectile dysfunction ED, there are two ways that Tadalafil may be prescribed. Your doctor will determine which is the best way for you to take Tadalafil. The first way is to take it as needed, usually at least 30 minutes before sexual activity. Tadalafil's effect on sexual ability may last up to 36 hours. The second way is to take Tadalafil regularly, once a day every day. If you take it this way, you may attempt sexual activity at any time between your doses. If you are taking Tadalafil to treat both ED and BPH, take it as directed by your doctor, usually once a day. If you are taking Tadalafil once daily for BPH, or for ED, or for both, take it regularly to get the most benefit from it. Take it at the same time each day to help you remember. And remember to tell your doctor if your condition does not improve or if it worsens. Common side effects of Tadalafil may include headache, stomach upset, back pain, muscle pain, stuffy nose, flushing, or dizziness. If any of these effects persist or worsen, notify your doctor or pharmacist. To reduce the risk of dizziness, get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of potential side effects. Many people using this medication do not experience serious side effects. Sexual activity may put extra strain on your heart, especially if you have heart problems. If you have heart problems and experience serious side effects such as severe dizziness, fainting, chest pain, or nausea while engaging in sexual activity, seek medical help immediately. Rarely, sudden decreased vision, including permanent blindness, in one or both eyes may occur. This is more likely if you have certain medical conditions such as heart disease, diabetes, high cholesterol, or high blood pressure. Stop taking Tadalafil and seek medical help if this occurs. Another rare side effect is a sudden decrease or loss of hearing, along with ringing in the ears and dizziness. Stop taking Tadalafil and seek medical help right away if these effects occur. In the rare event of a painful or prolonged erection lasting 4 or more hours, stop using this drug and seek medical help immediately, as permanent problems could occur. A serious allergic reaction to this drug is rare, but seek medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Before taking Tadalafil, it's important to talk to your doctor if you have any allergies or if you have a history of certain medical conditions such as heart problems, kidney or liver disease, high or low blood pressure, or eye problems. It's also important to let your doctor know if you are using alcohol or marijuana, as these can increase the dizziness caused by Tadalafil. If you are planning to have surgery, make sure to inform your doctor about all the medications and herbal products you are using. Tadalafil is not typically used in women and should only be used during pregnancy if clearly needed. It is also not known if this medication passes into breast milk, so it's best to consult with your doctor before breastfeeding. As always, make sure to talk to your healthcare provider about any concerns or questions you may have about taking Tadalafil. When taking Tadalafil, it's important to be aware of potential drug interactions that could affect how the medication works. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Tadalafil include riociguat and vericiguat. Tadalafil can cause a serious drop in blood pressure when used with nitrates, which can lead to dizziness, fainting, and rarely, heart attack or stroke. It's important not to use certain drugs used to treat chest pain/angina or recreational drugs containing amyl or butyl nitrite with Tadalafil. If you are also taking an alpha blocker medication to treat an enlarged prostate/BPH or high blood pressure, your blood pressure may get too low, leading to dizziness or fainting. Your doctor may start treatment with a lower dose of Tadalafil or adjust your alpha blocker medication to minimize your risk of low blood pressure. It's also important to be aware that other medications can affect the removal of Tadalafil from your body, which may affect how Tadalafil works. Examples of these medications include azole antifungals, macrolide antibiotics, HIV protease inhibitors, rifampin, and ritonavir, among others. Additionally, it's important not to take Tadalafil with any other product that contains Tadalafil or similar medications used to treat erectile dysfunction (ED) or pulmonary hypertension. If you or someone else has taken too much Tadalafil and experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. This medication is used to treat male sexual function problems, impotence or erectile dysfunction (ED). In combination with sexual stimulation, Tadalafil works by increasing blood flow to the penis to help a man get and keep an erection. Tadalafil is also used to treat the symptoms of an enlarged prostate, benign prostatic hyperplasia (BPH). It helps to relieve symptoms of BPH such as difficulty in beginning the flow of urine, weak stream, and the need to urinate frequently or urgently, including during the middle of the night. Tadalafil is thought to work by relaxing the smooth muscle in the prostate and bladder. This drug does not protect against sexually transmitted diseases, such as HIV, hepatitis B, gonorrhea, syphilis. Practice safe sex such as using latex condoms. Consult your doctor or pharmacist for more details. If you are taking Tadalafil on a regular schedule and you happen to miss a dose, just take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed one. Make sure to take your next dose at the regular time and never take a double dose to make up for the missed one. Make sure to store Tadalafil at room temperature away from light and moisture. It's important not to keep it in the bathroom and to always keep it away from children and pets. When it comes to getting rid of Tadalafil, don't flush it down the toilet or pour it into a drain, unless you've been instructed to do so. Instead, make sure to properly dispose of the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.